Righto, Bikefit basics. Now, anyone who was here last week, we were chatting about saddle pain a little bit, and this is a position I had a young lady come into me with a couple of weeks ago. Now, if I can make this clip work, excuse my technology problems. Let's see if we can pick up. Come on, you can do it. Yeah, great. Shouldn't really have the sound on here, but that's all right. So can you see what that right knee is doing? So right being on your left. So she came with knee pain. And you can see that saddle even just sitting up in there at the moment. And, you know, I had an hour booked in for a Bikefit and I needed about 2.5 minutes to sort it out. I really did. It was, so, you know, general position there, not horrible, not by a long stretch. Pretty nice bike. But that classic thing of what was happening around with that hip being thrown out. And so that was, and you can see that right hip, how much it's wiggling around in that position. And actually she wasn't super strong through the torso, full stop. But, you know, one of those classic ones of, sorry, let me just get this right, is, you know, look at the basic stuff. So if you're involved in bike fitting, whether you're in a shop or a physio or podiatry clinic, whatever you might be doing there, don't feel that you need to do all the fancy stuff with, you know, with wind trainers and torque wrenches and that. Sometimes just looking at someone really simply sitting on a bike and backpedaling there, you'll get a rough idea whether are they really low or is there something really obvious like this going on. I don't see too many like this, but we do get a couple there. We're going to talk about a few basic things here. So James, I might grab you if I may, and we might introduce Clay and Daryl to start intervening, having a few discussions, and also anyone who wants to make some comments as we go along here as well. There's some certainly people who know about bikes in here as well. Jump on the road bike. Okay, so James has informed me that apart from anything, this bike's going to be on sale soon. Ex-professionals bike, so if anyone's looking for an extremely good bike, an extremely good price, James will be happy to discuss it with you. So, basic things were here. So, quite a bit of James's cycling and his triathlon work was in, he was a professional with a team in Germany, lots of hilly rides. So the weight of the bike starts becoming important for someone who's very lean, as James was somewhere in that part of the world there. So these sort of positions, just turn the legs over if you can, James, while we chat about you. So when we're looking at people who are climbing hills there, we're looking for a light bike, a position that's efficient, and with the classic setup of the handlebars where they can be nice and upright on the hoods, as we'd call that position, even more upright on the tops, as James will demonstrate. Tops of the bars. Thank you. Really well choreographed. And then more aggressive and low down, heading into the headwind on the drops, basically. And one of the classic things I see in people come in for a general bike position is people who are set up and they've got this pristine handlebar tape down around here because they can't possibly reach their drops. They've got it set up aggressively at the front and they can only just reach their hoods. And I always say to them, particularly when they're, as we call them, weight weenies, and they've got their 7 kilo bike, I said, I can save you another 100 grams. I'll grab my hacksaw and I'll cut both of these off because you're not using it anyway. So it's one of the classic things we look at. Okay, come down to a stop for me there. So one of the things that I do when I'm looking at a bike is, I know James pretty well. I know he's got pretty flexible hips. I know how he works, and we don't have the time to go through it now. But the first thing I look at is hip flexibility, the ability to get the knee to the chest. And if you can bring that top knee up to the front there. And we look at this sort of position here, down on the drops in that low position. Now, if James has got stiff hips and he's trying to get into this kind of an aggressive position, as this knee comes to the top, he's going to do that. Okay, so we'll get a rocking in the hip. Or the other thing that he will do is slump, open up the hip from there, and all of a sudden he's in a lot of flexion in his lumbar spine there. So classic things, stiff hips, back problems, or problems around here. Now, relax again there. The other thing that someone will do to get around with stiff hips, and I think we showed a video of this last week, is they'll throw their knee out to the side. Okay, so, and if you're ever riding a bike and you're riding along behind someone, you've seen these knees doing this, it's generally that their saddle position or the handlebar position, so that drop between one to the other, is too aggressive for their range of motion. You can see if I sort of bring my knee this way, it goes there, whereas out to the side, my pants won't let me, but I'll go a lot further up out to the side there. So certainly looking at that, I have a look at how their spine works. It's one thing to have them standing up straight and say, right, James's spine is this long, but James has actually got quite a nice spine. I've got a pic that comes up shortly that talks a bit about the reach there as well, but getting that right. So saddle height we're going to talk about to start with. So really basic one that I give my patients with a sore knee who just want to go and ride a bike with their kids. You can have a sit up and relax if you want, mate. Is one of the things you can clip out and demonstrate. Just stay on the bike, just unclip one of your feet. Other one if you can, just so they can see on that side. Beautiful. Well, this is a well-oiled machine. Take that at the bottom of the stroke, your right one, and put your heel on the pedal. Yep. So this is a really rough and basic technique, but you can see that James's knee is straight in that position. So this is a really basic one, but it gets people in the ballpark, okay? And then, so he's actually got to reach a bit to go down there. But then when he goes to clip into that position, so he comes to the ball of his foot, he starts getting into a reasonable, somewhere in that 30-degree range of motion there. Now, one thing I didn't bring was my goniometer, but it somehow got left out. So what we look at, somewhere between 25 and 35 degrees is generally considered a position which is balanced between power and efficiency for the whole stroke. So it's not just about what you're doing at 25 to 35 degrees here, it's what that then turns into at the top of the stroke as well. So the physics and lots of research has come into there. You guys happy with those sort of numbers roughly? Yep, good. Now, the front to back, there's a lot of controversy over, a huge amount. So I'll go to the next one. Sorry, so I'll just quickly, because we are talking about the injury stuff following on from last week. So, classic things, stiff hips. So if I'm stiff in the hips and I'm backing down, if I'm coming back here, I'm closing my hips down. So one of the classic things we'll do is we'll bring someone up and forward if they're stiff in the hips. So it's one of those manipulations we can do. James, if you could just slide yourself forward and up a bit there. You can see even at that exaggeration how much it opens the hips up through there. Or if you push yourself right back on the saddle, you can see how much it closes that hip down. It also increases the flexion in the spine there. So classically the stiff hips, we look to go to a bit of a forward and up position there. And sore knees, classically, you know, even think about doing squats going to this position. To unload the knees, less flexion. So patellofemoral joint we're talking about classically here, which is the most common thing we see. And the greater the knee bend, the greater the force between the patella and the femur. So if we can keep people as high as possible there, it's going to minimise that force a little bit there.